Hello, my name is Taylor Lebeis, and I am one of the heart failure and transplant doctors at Michigan Medicine. I'll be discussing the use of hepatitis C donor hearts in the adult heart transplant population. I would first like to discuss the topics that we will cover today. What is hepatitis C, and how is it treated? What can hepatitis C do? Why should you accept a hepatitis C donor heart? How do we care for you after receiving a hepatitis C donor heart? What is the likelihood of curing hepatitis C after a heart transplant? Hepatitis C is a viral infection that affects your liver that is transmitted through blood-to-blood contact. If left untreated, it can lead to slowly progressing liver disease, liver cancer, and death due to liver failure. 4 to 5 million Americans have hepatitis C. 1 to 1.5% of all United States adults have hepatitis C, and 5 to 10% of organ donors have hepatitis C. Hepatitis C is curable in most cases due to highly effective medications called direct-acting antivirals such as glecaprevir, bibrentasvir, or GP. Hepatitis is spread by direct exposure to contaminated blood. People who inject drugs are at increased risk of acquiring and spreading hepatitis C to others. The diagnosis is made by checking for the hepatitis C antibody and nucleic acid testing. Antibodies are released into the bloodstream when someone gets infected. The antibody takes about 2 to 4 weeks to become detectable and must remain present for a prolonged period of time for a reactive diagnosis to be made. Nucleic acid testing, or NAT testing, is a special test that helps determine the presence of hepatitis C RNA or the genetic material of hepatitis C in the bloodstream. This test helps us understand whether a person is actively infected with hepatitis C or if it has resolved. Most patients with acute hepatitis C do not have any symptoms. Some patients have fatigue, fever, and stomach pain. Less than 10% develop jaundice, or yellowing of the skin and whites of the eyes. About 20 to 30% of people clear hepatitis C without treatment. Chronic hepatitis C can cause progressive liver damage and cirrhosis in some people. Cirrhosis can lead to liver failure, liver cancer, and death. Frequently, no symptoms develop until liver failure develops. Why use hepatitis C donor hearts? The wait list for heart transplant is long. There are thousands of patients waiting for a heart transplant in the United States. Wait time is dependent upon several factors, including listing status. 5 to 10% of organ donors have hepatitis C. Often, these organs are good quality from younger donors. In the past, hepatitis C infected organs were directed to patients with pre-existing hepatitis C infection, but now there are highly effective therapies called direct-acting antivirals that have a greater than 98% chance of clearing hepatitis C. By accepting a hepatitis C donor, you may improve your access to transplantation. Will you get a hepatitis C infection? There are 2 types of donors in hepatitis C. Antibody positive, nucleic acid testing positive, and antibody positive, nucleic acid testing negative. Donors that are both positive for the antibody and nucleic acid have the virus in their blood and are capable of transmitting hepatitis C. You will likely get hepatitis C, which can be treated by direct-acting antiviral medications. Donors that are antibody positive only were previously infected with hepatitis C, but the virus has now been cleared. There is a very low risk that you will get hepatitis C, and you will be monitored. If the hepatitis C infection is detected, you will be treated with a direct-acting antiviral medication. How do we treat a hepatitis C infection? We treat hepatitis using direct-acting oral antiviral agents. You will be treated with glecaprevir, bibrentasvir, or Mavyret once you are diagnosed with hepatitis C and are able to tolerate taking oral medications. The dosing is 3 tablets by mouth each morning with food for 8 weeks. Side effects include headaches, stomach aches, and fatigue. There is a greater than 98% cure rate if all pills are taken as prescribed. Why participate in this protocol? You may receive a heart transplant sooner. What may happen? You may develop a hepatitis C infection, and if so, you'll be treated for it with likely a cure of hepatitis C. Participation is your decision. Declining to receive a hepatitis C donor organ does not impact your care at U of M or your ability to receive an organ from donors without hepatitis C. After transplantation of an organ with hepatitis, we will plan to check labs to determine if you have been infected with hepatitis. They are more frequent early on and then space out after about day 28. If you do contract hepatitis, you will be started on treatment and your labs will be monitored closely during and after treatment as depicted in this chart. Will participating in this program affect my care at Michigan Medicine? Agreement to receive a heart from a donor with hepatitis C is voluntary and not required. Declining to receive a heart from a donor with hepatitis C will not affect your care in any way. Your decision will not change your place on the wait list. If you provide written acknowledgement of education about hepatitis C transplantation and meet criteria for hepatitis C donor organ transplantation, you are eligible to receive a heart from donors with or without hepatitis C. You can change your mind. You must provide written consent at the time of transplantation as well. Who can receive a heart from a hepatitis C donor? You must have prescription coverage for the direct-acting antiviral medication to treat hepatitis C. You must have transportation to Michigan Medicine for post-transplant clinic visits. You must have excellent compliance to medical treatment because resistance to the medications can develop if you don't take your medications. How will we protect you? We will only use high-quality hearts from hepatitis C donors. We will also screen our patients to make sure they are appropriate to receive hepatitis C donor organs and that they have appropriate insurance coverage for direct-acting antiviral medications. What is still unknown? Will all patients who receive a transplant from a donor with hepatitis C acquire hepatitis C? It is expected that nearly 100% of patients who receive a donor heart from an antibody-positive, NAT-positive donor will develop hepatitis C. Patients who receive a donor heart from a donor that is only antibody-positive and not NAT-positive are very unlikely to develop hepatitis C. The direct-acting antivirals have been as effective in patients who have gotten organ transplants. The risk of severe acute hepatitis C is small, less than 5%, and includes severe infection, liver failure, liver transplant, and death. What should you anticipate about your post-transplant care? If you receive a heart from a hepatitis C positive donor, you will be tested for hepatitis C infection for 1 year. If you test positive, you'll be treated with a direct-acting antiviral medication once you are able to swallow oral medications. You will need to bring this medication with you if you're admitted to any hospital or other facility. You will need to return to clinic visits and blood draws after transplantation. Now I will cover some frequently asked questions. Will the heart from a hepatitis C donor have problems from the hepatitis C? No. We will only use hearts that are otherwise good quality and expect it to function well. Can hepatitis C affect my heart or other organs? Rarely. Acute hepatitis C infection can cause problems with the liver, but once it is treated and cured, these problems will not occur. Once we treat and cure the hepatitis C, your heart or liver will not be affected by it anymore. Can I transmit hepatitis C to other people? Yes. While you remain hepatitis C RNA positive, you can transmit hepatitis C to another person through blood interaction and rarely through sex. You will be advised to take universal precautions when dealing with a cut or wound that bleeds. Do not share toothbrushes or razors with others. Use bleach to clean up dried blood and surfaces that have been contacted by blood. You will be advised to use barrier protection and contraception, condom or diaphragm, when having sexual relations during the period that you remain hepatitis C RNA positive. Hepatitis C is not passed person to person through casual contact, like hugging or shaking hands, or sharing things like glasses, utensils, or towels. Once you are cured of hepatitis C after taking medication, there is no risk of transmission to another person. Will the antiviral medications cause problems with other medications after transplantation? We will review all of your medications at the time you are called in to receive a hepatitis C donor heart. The antiviral medications are safe to take with your anti-rejection medications. The transplant pharmacist will work with your cardiologist to identify and manage any drug interactions. What if I am not cured of hepatitis C with antiviral medications after transplant? Although we expect that the antiviral medications will likely cure you of hepatitis C, there's a small possibility that the treatment will not cure you of infection. In those instances, we will obtain blood work to see if you have evidence of drug-resistant strains of hepatitis C. Based upon those test results, we will propose an alternative hepatitis C antiviral treatment regimen. Am I at risk of acquiring other infections if I have chose to receive an anti-hepatitis C positive donor organ? Due to shared risk factors, hepatitis C donors are at greater risk of having hepatitis B or HIV infection. We will only use hearts from donors who test negative for hepatitis B and HIV infections. The overall likelihood of these viruses not being detected during organ donor transplant screening is less than 1 in 100,000. You will undergo testing for hepatitis B and HIV infection about 4 to 8 weeks after transplantation as well. How much will the hepatitis C antiviral medication cost me? The transplant financial coordinator will verify your coverage in your insurance plan. You will be started on hepatitis C treatment as soon as possible after the transplant, and you are able to take oral medications. You will be responsible for the insurance copay. What if I lose my prescription coverage or my insurer won't pay for the cost of my hepatitis C antiviral medication? Our financial coordinator will check your insurance benefits before we agree to place you on the list to receive a hepatitis C heart. If your insurer will no longer provide prescription coverage for the medication after transplant, we will work with your insurance and patient assistance programs to help get coverage. In the event that you lose your insurance coverage post-transplant, we will help you with other resources to make sure you complete your hepatitis C antiviral medication course. What if I have to go to the local hospital after I am discharged from Michigan Medicine? Always tell any care provider that you are a transplant recipient. Always bring your medications with you, including your hepatitis C antiviral medication. Make sure to tell them that you received a hepatitis C positive donor heart and that you are taking antiviral medications and you cannot miss a dose. This concludes the presentation. Thank you for listening, and please reach out if you have further questions.